All right. Well, you have joined us for Prevention Works and a call to action with Kevin Haggerty. We're so glad you're here with us. So this has been being brought to you by the Great Lakes PTTC under a cooperative agreement from the Substance Abuse and Mental Health Services Administration, or SAMHSA. The opinions expressed in this webinar are the views of the speakers and do not reflect the official position of the Department of Health and Human Services. The PTTC believes that words matter and uses affirming language in all activities. I have a few housekeeping items. If you have technical issues, please individually message me, Rebecca Buller, in the chat section at the bottom of your screen, and we'll be happy to assist you. If captions or live transcript would be helpful, please use your Zoom toolbar near the bottom of your screen and choose live transcript. AI note taker options do not activate an AI note taker application. We do not allow this for several reasons, and we will ask you to disengage. If you do not, we'll have to remove you from the Zoom room. If you have questions for the speaker, please put those questions in the Q&A section at the bottom of your screen. That helps us not lose them in the chat and make sure that we get them addressed. At the end of this webinar, there will be a short survey that you will be directed to. It takes less than 3 minutes, and it helps us report to our funders and, more importantly, improve our offerings. And finally, certificates of attendance will be sent out via email to all who attended this webinar in full, and it can take up to 2 weeks for those certificates to show up. If you'd like to know more about what we're doing or information on upcoming events, please see our social media pages. And now I'm going to turn things over to Kevin.
Thanks, Rebecca. I'm really excited to be with you all. I'm going to just stop for a minute and share my desktop here so you can see kind of what I got going on. Hang on just a minute.
And Kevin, will you share your we're getting a picture of your family right now. And so we're not seeing your face.
Okay. That's because my camera's still off. And what else are you seeing?
We're seeing a consistent pattern, but we are seeing your slides and not in presentation mode, but there you go. That looks perfect.
There we go. Yeah. You'd think that after this long, I'd be so much more smooth with that, but it's going to take a minute for me. Hi, everyone. I'm so glad to be with you. Thanks so much for the invitation. I'm planning to talk a little bit about some good news about how we can think about prevention works. And then what does that mean? If we're really thinking that prevention is working, how do we respond to that? What's our call to action based on that? So I like to start by acknowledging the land upon which I sit. I'm in the Pacific Northwest. I'm a native of the Seattle area, and I live on and work on the land of the ancestral people of the coastal Salish, and particularly the Snoqualmie tribe is where I am. And I think it's just important for us to acknowledge our indigenous connections and histories of indigenous land dispossession. I don't know if you want to acknowledge in the chat the land you're sitting on. If you don't know, you can go to the website nativeland.ca to see where your land is. So a little bit about me. I've been working at the University of Washington in the School of Social Work at the Social Development and Research Group for 39 years on Saturday. So it's been a long haul. I started working, they pulled me out of a juvenile institution. I was working in a juvenile delinquency institution and really started focusing on the causes and consequences of delinquency and substance use. So really understanding what's putting young people at risk and what can we do about it. So spent a lot of years testing interventions at the family level, the school level, in the community, and even at the individual and peer levels. So I have a lot of tested programs that I've designed and tested to see, can we really make a difference? Can we move the lever? Can we actually change the trajectory of substance use and change conditions to promote well-being at different levels. Why is that important to me? Well, it's important to me because I'm a dad of 3 kids. My first child was born in 1983, and I now have 4 different grandkids, and from about 20 months to 6 years old. And I often think about, when was it more, when were kids safer in terms of development? In 1983, when my first son was born, or last year when my youngest grandson was born? Think about that as we talk about some of the data today. There's a couple other things I wanted just to highlight before we move on. First, this is a sensitive topic that we talk about, prevention working. If it's working, what does that mean if I've had a difficult time in my life with someone who's misused substances? So I realize the sensitivity of this conversation. And you might as well, and you just kind of hold that as we kind of talk about what we're seeing and hearing. The second thing is, there's going to be a lot of data. And so I've asked Chris Gabrielson to help me out. And if I get lost in some of the data, she's going to say, "Hey, Kevin, what's the point? Give me the point. Tell me the point of that slide." And I think that'll help a lot. Because what we're really going to be looking at is normative trends over time. And when you see a trend in 3 different data points, we'll call that a normative trend and see how things are shaping up. And then the last thing I want to just caution or just put on the table is that all data are local. And so we'll be looking mostly at national trend data. I have a few data slides from some of your states, but typically you'd want to look at the local level for your own data, because there's a huge variation in how the data end up looking at the local level. Now, my wife and I love to take walks in nature in our neighborhood. And we have this thing about looking for hearts. We look for heart rocks, and you can see a collection of heart rocks that we found, and we have a little heart rock grotto by the river. We take a walk by a pasture, and you can even see the heart on the cow, in the shape of the cow, and even like in chopped wood, you can see the heart, and the little light light up. These patterns all kind of give us that sense that there's really something bigger going on here. There's something bigger going on in our life. And, this would be a symbol of love for us, the big thing that's going on. So we're going to be looking at some data today. And the idea is let's step back a little bit and look at the bigger pattern of what data are telling us. And then what does that mean for how we actually engage in prevention? So this is just my little way of reminding us that we do look at patterns in different ways in our lives. And this is our challenge for this session, to look at the patterns in the data. Now, Rebecca's going to launch a poll here. And the poll is going to ask, how familiar are you with the monitoring the future data? And the second question is, how familiar are you with the Blueprints for Healthy Youth Development website? So just take a moment and answer the poll. There's 2 questions, and this will help us in terms of what and how to present the data today. Thanks everyone who's participating. We're getting there. And Rebecca, when you think we've gotten about 90% of the folks who've participated, let's go ahead and close the poll. We still have about 10% more if you'd be willing to participate. We don't want to settle for an 80% response rate. Okay, let's go ahead and close the poll. And do you mind launching or sharing oh, you are sharing them. So there's a few folks who are extremely familiar with monitoring the future. I would say the broad majority are somewhat or not at all familiar with it. So that's helpful to know. It's a good reason people probably are on this call. And then there's some folks who are familiar with blueprints, but the bulk of folks are not um, very familiar. Um, so that's good to know because we can, this isn't going to be repetitive or redundant for folks. I'm going to stop the share now and move on. And we have three key objectives to today's session. The first is to explore the monitoring the future and take a look at some state trends and data, as I was talking about. I want to focus on three key websites that might be helpful for you. And then Chris has another set of data or set of resources that might be useful to look at tested and effective programs for prevention. And then really to think about, okay, what is the call to action? How do we identify focus area? And what do we need to think about based on the national data points? So monitoring the future, we're going to jump in there. Now, monitoring the future, MTF, is this long-standing project at the Institute of Social Research at University of Michigan. And they've been doing this since about 1975. I graduated from 1976, and that's when you look at the national data, some of the drug use data that's at the very peak is 1976, 77, 78. Yeah. So the purpose is to examine the trends over time in beliefs, attitudes, and substance use amongst adolescents, young adults, and midlife adults. Now, a lot of people don't know that there's a young adult and midlife adult section as well being studied. And that's because we're pretty used to the 8th, 10th, and 12th grade data that comes out every year. And there is a longitudinal follow-up surveys of 12th grade subsample through age 65. So that would be, remember I told you that, I was in the early go on that. I wasn't in the sample, but they've had been doing follow-up data since that time. So if you're really interested in looking at longitudinally, particularly at midlife and older adults, it's a great data set for that as well. So here's our second poll. Rebecca's going to drop this in. And this is just kind of looking at what you're thinking about trends in long-term trends in alcohol use and illegal drugs, cannabis use. So just answer these questions. They're true or false questions.
And Kevin, I might just make sure people know to scroll down to see all four.
Scroll down. Thanks, Chris. Oh, I lost the poll. So Rebecca, when it's time to
Yep.
share the results.
I will. I'd be happy to. We're at about 40% right now, so.
All right. Give folks a moment to look at these questions. And it'll be a surprise for me to see how people are answering.
All right, we're at 83%.
Okay, well, let's take a look at what people say.
All righty, here are the results. Can you see them?
Yeah, I can. Can everybody else?
Yes, they should be.
Okay, well, look, there's a pretty even split on whether or not trends in long-term decline in tobacco, alcohol, and illegal drugs among high school youth are decreasing. And people are thinking that cannabis use has increased along with legalization, medical and retail in 38 states. Notice I don't call it recreational marijuana. I call it retail marijuana because recreation is tennis, recreation is fishing, recreation is skiing, recreation is not using cannabis, just for the record. More young people are graduating from high school drug-free. There's kind of a mix on that. Most people think that that's true just by 54 to 46%. And then youth fentanyl use and overdoses are increasing, and most people believe that that's to be true. So let's keep that in mind as we start looking at the data. And I have kind of some key things I want to share with you, but I want to first share with you the monitoring the future dashboard, because it's kind of a cool function. And you're going to have this website dropped into the chat box, and you'll be able to click on it. And here you should be able to see the monitoring the future dashboard. And I'm going to click on this. And hang on a minute, and I can go in here, and this gives me trends in the last 12 months of the prevalence of use in 8th, 10th, and 12th graders for alcohol. And you can see this relatively steep decline. Back here in 1975, 85.7, that's the year I graduated from high school, right there. 85.7 of 12th graders said they'd used alcohol in the last month, compared to 45.7 in 2023. Wow, that's a steep decline. Same with 10th graders. And you look at the steep decline amongst 8th graders. Now, what's cool about this is you can go to other, all these other, if you look at cigarettes, for example, and look at the trends over time. Or if you can click on, maybe heroin. Not a lot happening in heroin. So it's a great tool for you to be able to use to look at national trends over time and see any illicit drug use, for example. You can see steep declines in the pattern of, and that this includes cannabis, because cannabis is still not legal. Okay, then I think I go Alt Tab, and I'm going to come right back to here. And there's some key takeaways from the data that I'm hoping you will take with you. First, something to be celebrated. Prevention works. Trends suggest a long-term decline in tobacco use, alcohol use, and most illegal drugs among high school youth. It's really incredible. When I started this work 39 years ago, I didn't think we would make a dent in alcohol use. It was so normative. See that steep decline and that same decline with binge drinking? It's pretty amazing. Second, youth cannabis use has really stayed relatively flat despite legalization in 38 states. It hasn't had a big spike. In fact, in young adult data that we've done in Washington state, we actually see that from ages 18 to 20, it stays flat. It isn't until age of legalization where you see an uptick. Most young people are graduating from high school drug-free than any other time since 1975. And despite these promising trends, youth fentanyl use and overdoses are increasing. So what do we do about that? Well, first, let's celebrate the fact that we see this steep decrease in trends. And here, Chris, the point of this slide is to note that there's been a steep drop. You see all this at the end here, you see all this up and down. That's all that stuff related to COVID. But if you take that and just kind of make a, swing through that, you see this steep decrease from, if you go back in time, and from 1990, you're still seeing the steep decrease in any alcohol use in the last 12 months amongst 8th, 10th, and 12th graders.
So Kevin, I'm curious then, what can you attribute this to, that there's a steep decline?
Yeah, that's a good question. I started going down rabbit holes on this one, Chris. There's a lot of things. Access has decreased, for example. Young people, like in Washington state, 59% of them said that it was easy or sort of easy to get alcohol in 2010 compared to 40% in 2023. So access just individually might be a part of it. Parents having conversations with their kids about using has increased. Parent attitudes have toward use have decreased. So parents are having conversations with their kids. We're seeing a trend toward decreased attitudes. And interestingly, personal disapproval of use has decreased. So people don't think it's as cool to use as they used to.
And how do you think
Interestingly,
all these things happen in terms of reducing access, changing our norms, changing the
why
peer?
do I think they happen?
Yeah,
Because we put a lot of energy into prevention, haven't we?
absolutely. All the work that's been done.
All the work that's been done. And if you really think about that, it's taken a while for that to kick into gear. So we really start seeing the big increases in the early, like 2010 and later. And that's where things have really sharply started dropping. Interestingly, Gen Z, for example, that's this group between 13 and 28, they're drinking 20% less than other generations at that same age. Now, if you look in the industry about what's taken off, 2024 is the year of NA, non-alcoholic drinks. And you can really see that starting to explode in terms of industry. The alcohol industry is really paying attention, and there's all kinds of NA beers, NA spirits, all this stuff, because there's a real health conscious group of people coming up that's just not drinking the way previous generations have. That's good news. And one of the things they attribute that to, Chris, is that this younger generation has a real sense of healthfulness and wanting to be healthy.
That's great.
Yeah, it's pretty
Love
impressive.
seeing that. I love seeing that.
Now, here's another example of where we see cannabis. And remember, I said it's stayed relatively flat. Here, you're actually going against that and seeing declines. And this is typical even in states like mine, where retail cannabis is legal. We were one of the first to legalize. The sky has not fallen. Things have not gotten out of control, even in states that have legalized. There's, yes, increased use after age 21, absolutely.
And
But
Kevin, I was going to ask real quickly, there is a question in the Q&A that people are wondering, with this data that you're showing on monitoring the future, can people look at it by state as well, or only national?
only national.
Okay.
Yeah. It's unfortunate that way.
Yeah.
Because they, when you look at it's like 400, I think 400 schools in different areas. So it's a sampling strategy rather than a census strategy, where most of our, like YRBS is a more census strategy, or some of our state data. We try to get as many in the state as we can. This is a sampling strategy here.
Yeah. And I see in the chat that, don't states have their own versions, and absolutely there's different state data. There is data there, but it's just not through this monitoring the future survey.
Yes. And this is the oldest data that we have kind of as comparative. So what I like to do with this is compare my state data to the national norm. And this would be the national norm. What's important about this is when you look over time, the national norm is shifting downward. And that's important because we want to be communicating not this scary upward trend, everything's going to hell in a handbasket, but that actually there's a downward trend and things are getting better. People don't believe that. I don't know why. I'm working with the lead physician for all of our incarcerated individuals in Washington State. And she's convinced that cannabis use is on the rise. And our state data were just released last week, and they look like this, where we see a continued decrease in cannabis use amongst 8th, 10th, and 12th graders.
So this is where it comes in that in terms of our messaging, in terms of prevention works.
This is why it's so important, because we have like descriptive norms around what people perceive is going on, and they perceive things much different than what the data are telling us. Like here, with cannabis use, in 1996, 58.3 perceived regular use as risky, And in 2023, 27% perceived regular use as risky. We used to think perception of risky use was a big risk factor. That doesn't seem to be the case here, as we see decreased use as risk also goes down. When you look overall at trends in the last 12 months of illicit drugs other than cannabis, in 1996, for example, 16.7% of 12th graders had used, or this is 10th graders, had used illegal drugs other than cannabis, compared to 5.7 in 2023. Like, if you think about this as a market share and you think you've moved from 16% to 5%, that's a huge drop. You'd be really worried about things. Folks worried about opioids, and trends in the last 12 months of use for 8th, 10th, and 12th graders for OxyContin, for example, are really, really extremely low. And this is typical across the board, typically less than 1%.
Kevin, there's a question of that somebody noticed that fentanyl was not in the drop-down menu that you showed, and they're curious why.
Yeah, I think they didn't ask about it, and they haven't been asking about it. They probably will add that. It's probably in, that's why I put OxyContin in, because it's a prescription opioid, but fentanyl hasn't been asked.
Okay, thank you.
In our state, we looked at the fentanyl, and it's 0.8, no, 0.08, like less than 1% has used fentanyl ever. So if 10th graders, so it's quite low. And for those people who do use fentanyl, the consequences are quite large. I'll talk about fentanyl in a few minutes, but it's a good question. They don't have that in the national data here. Vaping, you might recall in 2017, there was this big, huge issue around vaping, and people actually had serious complications due to vaping. And we've seen a steep decrease in vaping since 2017. Again, significantly different than previous years in the past 5 years. And more youth are graduating drug-free than at any other time. Now, this data only takes me to 2018. But if you go back to when I graduated from high school, back in 1976 here, all the way to the right, yeah, all the way, keep going. And it says past month non-use. And that means that there's been no use in the past month of any alcohol, cigarettes, marijuana, or illicit drugs. And just about maybe 25% had not used in the past month, compared to 59, almost 60% in 2018. And that has continued. I just couldn't update this particular cute graphic, so I left it the way it was. That's important. It's important that people are graduating drug-free. Look at the lifetime non-use. It was, very few people in 1976 had not used, compared to almost a third in 2018. That's really
Kevin,
impressive.
I'm wondering why isn't this headline news? I mean, why?
Oh, are you? Yes, I'm wondering the same thing. Why isn't it? We're going to get to that question. I have it as one of my questions, and I think I have some answers, but I'm going to be interested to see what other people say, because I wonder about this all the time. In fact, our state data came out last week, and it shows this same trend, all these same trends. And they sent out a really good press release, including decreases in mental health problems amongst young people, including like suicide attempts, deep decreases. And they sent a press release out talking about resilience in young people. And our largest paper in Washington State has not printed it. It is not news to them. Why don't we want the good news? We'll talk about that in a few minutes. Now, you might say, oh, yeah, but that's just the, monitoring the future data. There's other data that maybe that doesn't look like that. Remember the patterns that I talked about? Let's look at the patterns. This is the YRBS data, and you see the same pattern of decreasing trends in vaping and marijuana and alcohol, cigarettes, illicit drugs, and prescription pain medicine. So this isn't just an anomaly. Your state data has the same kind of thing. Here in Illinois, I'm comparing it to the national data in 2013 on the YRBS. And you see this, if you look at the right side is the state of Illinois, and it's compared to national data because I couldn't find the Illinois data for 2013, but you can say it's pretty close to the same. Look at smoking in the past 30 days from 2013 to Illinois in 2021. Went from 22.4% to 2.5%. And that's very typical of the national trend in smoking amongst high school students. So we're seeing this steep decrease. Like I love to see the binge drinking one. 1 in 5 young people in high school were binge drinking in the past 30 days in 2013. In the state of Illinois, that's gone down to almost 1 in 10. It's almost dropped in half in less than 10 years. That's impressive. Minnesota, looking at any tobacco use, it demonstrates a significant decline from 26.4% and 5.2% in 2017. So it's dropped 6% for high school and about 1% for middle school. That's really impressive. Everuse has also seen a statistically significant decline from 2017 of about 10% and 4% in middle school.
So Kevin,
This
there's
is a big
quite
deal.
a few questions and comments in the Q&A and the chat of wondering that they're questioning the validity of the data. Is it, it could it be that this data is looking better because schools aren't participating as much, or there's a decline in school participation, sample sizes decreasing, etc. What are your thoughts about that? Can we trust what you're sharing here? Is it real? Is it true?
Well, I used to have a data slide, and I didn't include that in here, where I had the rates from 5 different surveys, local survey, a state survey, the Monitoring the Future survey, another state survey, and the data were all the same number. 40% of 10th graders had tried alcohol in the lab, or had alcohol. I think it was something like that. So there is variation in the data. That's true. In our healthy use survey, for example, in Washington State, we have ways of cleaning the data to take out anyone who says they've used everything, or if people lie. And remember I said we're looking for patterns, and I showed the rocks and the stump and the heart shapes, and just kind of figure that's a symbol that love is important in our lives. I kind of got to take a look at the pattern of data and say, oh, look, here's another Wisconsin. And you look at the trends over time in Wisconsin. Why are we seeing trends in Minnesota and Wisconsin and Illinois? I mean, these are, different data points, and you see it in this data as well. Why do we not want to believe our data? That's the first thing I would ask.
Mm-hmm.
Why is it so hard to believe good news?
That's what I wonder. I wonder if trends were going up, if people would question it.
No.
That's where my mind is.
So this is data from the Wisconsin Department of Health Services, and just as a screenshot of percentage who've ever used consumed alcohol over time. And it goes from 71.2% to 58.4% in 2019. And I don't have the age group on here. I'm sorry. This is in high school, and it's from 70.8 to 56%. So we're seeing the same pattern over time. And I know it's hard to believe, but we're actually seeing that happen. And we do know that while we do see these declines, disparities continue to exist. And these disparities are stronger, for example, in our Washington state data. We often look at race, and there are some race disparities, but they're strongest in, for example, disparities based on sexually and gender diverse populations where mental health outcomes are 2 to 4% higher, or 2 times to 4 times higher, I'm sorry. And with people with disabilities, 4 to 6 times higher for things like planning and attempting suicide. So it is important to be asking those kinds of questions. We have used this data to help legitimize why we ask people about their sexual orientation and gender identity. And in our state data, we ask that because we see these disparities, and we think it's really important to highlight those. I'm going back to this question, Chris, you asked around, can we believe the data? And these are other kinds of outcomes that move us away from substances. And this is rates of juvenile in residential placement by race and ethnicity, just up till 2019. And we're seeing the same trend in, we've seen a 75% reduction in residential placement of young people since the early 2000s. So we're seeing a real, and it's across these different groups, with the highest decrease in terms of Black youth. You can see that steep decline. And again, I'm looking for patterns here. So I'm seeing it. And now it's hard to believe because we think everything is so much worse than it was. But if you go back to the 90s, things were pretty bad. And if you go back here to 1990 and we look at birth rates for females ages 15 to 19, you see like for the Black population, 118.2 per thousand females, 118.2 births, down to, in 2020, about 24.4. That's a deep decline. So we're seeing a decline in substance use, in delinquency, in teenage pregnancy, of birth rates. Those are really important outcomes. So this gets to the question that you asked. Why isn't this front page news, Chris? Why? Just tell me. I have
I was going to say, it's interesting. There's a lot of discussion going on in the chat, and it's interesting that a lot of people, from their perspective of seeing in the work they're doing, they are not seeing this improvement personally.
That's what I said at the beginning, because our own experience really can get in the way of looking at the norming trend over time. And that's a really good example of the physician that I work with who's working, I'm working with kids in juvenile detention. When I look at that population of the incarcerated population, it doesn't look good. And it looks really bad because those people who are incarcerated now are so much worse than the kids who were incarcerated when I was working there 40 years ago. So if I just looked through that narrow point of view, my point of view would be very, very different.
Yeah.
That's why I have to step back. That's why we're doing this. We're stepping back. We're trying to take a bigger picture and look at kind of what are the patterns over time. So one of the questions I thought about, because I'm writing a grant right now, and one of the things you have to do when you're writing a grant is you have to show the need. And if I'm showing this decreased trend over time, how do I show the need? Even in my own community, I might be showing, well, you can compare it to the local data, your local data to the national data, and maybe you're increased over the national data. Or you can look at your trend over time and say, we've seen this decreased trend, and this is due partially to the work we've been doing. That's why we need continued funding. So looking at your normative trend and making a case based on the work you've been doing, that's why you need to continue that work. Kind of like fluoride in the water. I know fluoride can be controversial in some communities, but you just don't fluoridate the water and then stop fluoridating the water and say, okay, everybody's teeth are going to be fine. It's something that needs to be continuous, like prevention in the community. And then I was thinking about that people don't want to hear good news. And I was thinking, Chris, about the fact that, we have both those descriptive norms and the perceptions of how people are, and we can use data to help change the norm of what's happening in communities. And I think in our role as prevention professionals, we should be using the most current data to help reshape the norms of what's going on.
And that's a few people have talked about positive community norms in the chat in terms of the social norms marketing kind of campaigns. And I think that's right in line with just what you said.
Right. And we want to really like that whole thing around Gen X. I mean, that is not self-report data norms around the 20% decrease in alcohol use. That's industry norm. That's industry data. They're not selling as much booze to that population.
And was it
That's
Gen X or Gen Z?
Gen Z.
Okay. Just double
Yeah,
checking.
sorry. Gen X, no, they're still on. Yeah, they're still cruising along. No, the Gen Z, thanks for the clarification. Yeah. So that's, these are all really good things. And the industry is worried about it. They're worried about what is the future of alcohol sales to that population. Sometimes I like to go to the industry because it helps with that pattern of data that I talked about. Okay, you want to know another reason why this isn't front page news?
Yes.
Because for those people who do walk through that door of substance use, the consequences are much greater.
Yeah.
The reality is we're losing kids.
Mm-hmm.
And you can't celebrate a decrease in substance use when we know that we're losing the equivalent of a classroom every week from a drug overdose. Most of those people who are using overdosing die at home. One of the things on this slide that really strikes me is 1 in 3 teens had used opioids before. You know what that means? 2 in 3 had not used opioids before. So we're losing people to opioid overdose. 66% who hadn't used opioids before. That might be because the product is laced. They don't know what they're using. But I think it's really hard to celebrate the positive decreased trends over time when we're seeing the ravages of the fentanyl crisis in our own communities. And I think that makes it hard. And, in my own community, we've seen this really steep increase in the number of young people who've died from overdose, such as fentanyl. And it's alarming. It's alarming to all of us who work in this field. Like, what do we do? How do we deal with this? And we see this trajectory of US overdose where we continue to be in this crisis. And this crisis it used to be when I was working with NIDA, we had a panel on opioid overdose. And it was like, well, it's not happening at the younger ages. And that actually, in fact, is not true anymore. It is happening at younger ages. And part of the reason it's happening at younger ages is really because it's cheap and available. It's cheap. Like for 50 cents to $1, you can get fentanyl tablets. So it really makes it accessible and available. And people don't know what they're getting into. So we have a cheap drug that can be used and has the potential to kill people. And that is moving toward younger ages. So this is up through 2022 data, and you're just seeing how fentanyl involved and non-fentanyl overdose rates for 15 to 19 years prior to and during the COVID pandemic. And you're seeing a higher increase in overdose death rates, while still very low if you think about it. So this is 1.5 or 1.7 per 100,000 of the population. The trend increase is still quite high and alarming. The numbers are still low, but it's hard to get optimistic and excited when we have people who are dying. And I think it's, if you look at drug overdose rates amongst 15 to 24-year-olds, and you look at the blue line going up, it's higher than COVID almost across the board until you get up to 55 to 64ers. And so overdose death rates are outpacing COVID. And, you know, there are things that we can be doing. It's interesting how with COVID, we got COVID test kits sent to our home, and carrying naloxone is one of the important overdose prevention strategies. I do think that I worry that we get so focused on this part of prevention, on overdose prevention, that we lose sight of that core prevention work that we do, that universal and really early upstream prevention. But it is important for us as prevention folks to be aware of counterfeit pills and heroin, to make sure people know that they shouldn't use alone. And to start with that, these are all harm reduction approaches to preventing overdose. Now, having said that, we have to be a little bit cautious, because the key distribution of overdose deaths, for example, in King County, are not for young people. So the less than 20 years old, you can see at the top in the green, is a very small percent of the population that is experiencing overdose deaths in King County. And when you look in King County by race ethnicity, you see huge disparity among American Indian and Alaska Native. And when we ask about things in like in Washington State about report of use of heroin, oxy, or fentanyl, it's a very small percent of the population who reports using those, less than 1%. But after high school, these rates go up. And you can see in the 20 to 29-year-old range that about a third of overdose, 33.4 deaths per 100,000. So overdose rates increase during that developmental period quite dramatically. And Chris, this is the point that I like to make here. And I'd like to hear what you think about this. On the right, you see no past month marijuana use, and you see that it's related very little to alcohol use, binge drinking, heavy alcohol use, cigarette use, and look at the blue as other illicit drugs. But when people are using, for example, cannabis, it is related to heavier alcohol use, to cigarette use, and other illicit drug use. Now, as a prevention person, why is that important? Well, the point of this slide, Chris, would be if we're really focused on those upfront early predictors of marijuana use, we're also preventing alcohol use, cigarette use, and other illicit drug use. So to me, kind of not throwing the baby out with the bathwater and saying, okay, we have to throw everything at fentanyl right now could be a problem because we do need to keep our current prevention intact. That's what our call to action is. We can't let up because the work that we are doing is having an effect, and that is actually suppressing the fentanyl crisis. Well, and if you don't believe me, take it from Nora Volkow, who's the director of the National Institute on Drug Abuse. And I just think she talks about this so well in saying that the escalating danger of the illicit drug supply points to a need for greater and expanded focus on prevention. And that is really important. Time and time again, I see the Surgeon General saying that. I see Nora comes back to this frequently around family programs that can be used to focus on prevention. So what are your thoughts about that, Chris?
I completely agree. Of course, I'm a fan of primary prevention, have been for over 30 years. And just knowing that, and I know you're going to talk about cost savings in a little bit, that, in our society, though, that, thinking about what we can do to prevent not just the use of these, substances, but also the consequences of them, and
Right.
the reducing the impact of the pain and despair and all the things that happen with substance misuse. To be able to prevent that, it's in my heart and soul. And so we also, at the same time, as I say that, when we're thinking about these primary prevention strategies, to not get I feel like it's sometimes the tail wagging the dog kind of thing, in terms of the drug of the day kind of thing,
Right.
that whatever's escalating at that moment, then we get money saying, okay, you have to prevent drug use of this specific substance. Well, if we stay true to our primary prevention strategies, I love that slide of showing, yep, that one,
Yeah,
that if we are
that's why I
doing
put this.
strong evidence-based prevention strategies, we can reduce substance abuse. It doesn't matter what the drug of the day is, and I don't
Right.
mean to say that glibly at all, but if we're doing the strong prevention strategies, then we're going to prevent substance misuse of all kinds of drugs, and things that we don't even know are going to come about in the future.
Well, let's take a look at that because one, you brought up a couple questions and I'm going to answer, not questions, but comments. One thing is that how do you find those best effective programs? And there are three areas that I think we're going to take a look at. One, I love the blueprints for healthy development because it is probably the one that has the highest rigor of standards in terms of evidence. I also really love the Surgeon General's report. Chapter 3 of the Surgeon General's report provides some really good evidence on programs, both environmental and programmatic, for preventing problems. And then I like to look at the Washington State Institute for Public Policy because they have a really great assessment of how we save money using prevention. I was going to jump into this blueprints, but before we do that, I want to just show data, kind of like what Chris was talking about, that when this is from Iowa Strengthening Families Program, and it looks at young adult outcomes and lifetime prescription drug misuse. And you can see in the blue, those are people who were in the Iowa Strengthening Families Program, and it's comparing it to the control condition. And you can see just generally their substance use and their narcotic use in the second one. So at age 21, you can see those. And at age 25, you can see that the strengthening families has a significant impact in reducing general drug use overall, but that also translates into narcotic drug use, kind of like what Chris was just telling us about. So I wanted to jump to these data points because it just is a good illustration of what Chris just talked about, that when we're addressing those early upfront factors, we're actually impacting the drug of the day. And we see that same kind of pattern. Again, remember, I'm talking about patterns, that life skills training program reduced the risk of opioid misuse by grade 12. And you can see that the school program alone, in that green bar on the left, is life skills training alone reduced the likelihood of opioid misuse through 12th grade.
Kevin,
But
can you explain this graph a little bit to me? I'm not used to looking at this. So the zero line means what? And the below and
no
the above
effect.
means what?
0 is a no effect.
Okay.
2 is the percent change in the likelihood of opioid misuse. And so the blue bar, or the yellow bar on the left, shows that about a 2% more likely to use opioids for all stars. So it'd be the wrong direction. Project Alert in the blue would be the wrong direction. Life skills training would be about 4% less likely to use opioids through 12th grade. All stars about 7, and life skills with strengthening families. So when you connect life skills training with strengthening families programs, the effects are even stronger. That's the point here. We saw strengthening families right here alone. When you combined it with life skills training in the schools, the combined program is even stronger.
So
Why
this
is
is oh, sorry, you're probably about to say what I was just going to say. Go for it.
just doing a single program isn't enough sometimes. You can get strength by doing a parent program and a school program, for example. And I think this is a really good illustration of doing those combined programs. You see the outcome being stronger. So now I'm going to go back to that question of where do you find these programs? Did I answer your question?
Yes, you did, Kevin. Thanks.
I'm going to go to this question of where do you find these programs, and I'm going to go to blueprints. And this is the blueprints for healthy youth development, and you should have this in your chat. And if you go to find programs, I like the way they have this set up. You can go over here to program outcomes. And so for this example, let's just go to, because we've been talking about substances, we're going to click on problem behavior, and we're going to go to alcohol. We want to prevent alcohol. We want to prevent illicit drug use. And let's see, is cannabis in here? Marijuana? Probably, maybe not. Marijuana and cannabis. Let's see what that comes up with. So I'm just looking at outcomes. I'm not looking at risk factors right now, but there's model and model plus programs. There's 7 of them. And look, right here's life skills training, the one we were just looking at. But here's brief screening for college students. And these have some of the highest rigor of evidence that you can find in terms of randomized controlled trials with a variety of different populations. And these are programs that are the highest rated, the model and model plus. So Project Towards No Drug Abuse, the Blues program for mental health outcomes and substance use outcomes. So quite a few different, but in the promising, still having really strong evidence, you see a whole list of other programs and practices, cooperative learning, for example, in schools. And here, if we go down the list, I think? Well, here you see Strengthening Families 10 to 14. Those two programs we talked about earlier and showed how they have a big effect. So I like coming to this website to find the best evidence because someone else is doing the work for me on evaluating the evidence. I also like to move upstream. And by moving upstream, I like to think about what are the underlying factors that might be impacting people. And so, for example, here, I think you're able to see me scrolling through the risk and protective factors. And I'm going to say that in my community, we're seeing parent stress and poor family management. And let's see, now I have fewer programs. I have one program here and two in Promising, Keeps Safe and Strong African American Families program. So sometimes it's helpful to go to the risk factors as well as the, I'm going to move out of here. As well as the, give me a sec. Just the outcomes. So that's the Blueprints programs. You should have that link in your chat, and I encourage folks to take a look at it.
Kevin, can I make just one point about that, the Blueprints website, that you can click on outcomes and it shows the research being done. And that's another way that if you're making a case for prevention within your community, that prevention works, you can go to that research and pull out things. For example, if you are implementing those programs within your community, you can pull out that data to provide evidence of why we should be doing this and making a case for prevention within your community. Would you agree?
Oh yeah, and there's great resources in there summarizing the data. I could go back, but those have been tested programs, and you can see the level of impact that those programs have had. So like the life skills training, we'll have a little summary of the impact. Strengthening Families would have that same kind of summary that I demonstrated in the slides. So yes, just that alone, using programs that have a track record of showing impact in a variety of populations is an important thing. So here's where it's so exciting is that there is a really strong bank of evidence-based approaches that work. Now in region, you use something from region 9 that you found to be helpful too. Can you talk about that for a minute before we move into the Surgeon General report?
Sure, yeah. And Rebecca's going to put the link in the chat to, it's actually a document that the Region 9 PTTC, the Pacific Southwest PTTC created. It's a guide to online registries. So Blueprints is one registry, online registry of evidence-based programs. There are other websites that have more information on evidence-based strategies. So I highly encourage you to download that document and use that as another resource for looking at evidence-based strategies for your community.
We talked earlier about the Surgeon General's report, and Chapter 3 is the chapter in the Surgeon General's report that's really helpful in kind of giving a whole rationale on how prevention does work and how important prevention is. It, in community-based, family-based, school-based environments, and brief interventions in colleges, workplace, and primary care. And they have a whole array of different types of programs. So for example, from 0 to 10, you can see this list of different approaches for 0 to 10-year-olds having an impact on substance misuse. One relatively pretty simple to implement approach is the good behavior game. For example, for older youth, 10 to 18, you can see a whole host of different approaches that have been tested and demonstrated impact and kind of got mustered with the Attorney General. Life skills training is one of those, strengthening families 10 to 14, another as an example of programs that we just talked about. So I strongly recommend folks kind of connect to the Surgeon General report and that's from 2016 as an example of how to use in your community programs that have the evidence. And you can take that back and say, hey, we know that these programs have an impact. So the third area I kind of wanted to demonstrate to you was the Washington State Institute for Public Policy. We call it WISIP in Washington State. And WISIP is a nonpartisan branch of our government that is designed to evaluate the cost benefit or the benefit costs of policies and programs. And I'm going to try to move us to WISIP here. And Chris, will you tell me if this is big enough when I get to the benefit cost? Because I'm going to go here and we're going to look at some benefit cost results. And I'm going to just take a minute. I know there's a lot on this page, but I'm going to take a minute to show across here. These are all research areas: juvenile justice, crime, child welfare, education, all the way. You can just kind of read along. We're going to stop here at the public health and prevention. Why? Because I like prevention. That's my area, right? So we're going to go to prevention and see what is cost beneficial in the prevention area. Now we're going to go down, and these are school-based approaches. The first section is school-based approaches. And I'm going to just demonstrate on this top one. Positive action is a program that's often done in elementary school. It was reviewed in September of 2018. The total benefit was $36,896, and that included 9,351 direct taxpayer benefit, and then 27,545. This would be like non-taxpayer benefit, like graduating from high school and making more income later in life, those kinds of things. The costs, $1,089. So they subtract that cost from the benefit minus the overall benefit. And so you see a 35,707 benefit. And so for every dollar invested in positive action, you can expect a lifetime benefit to cost ratio of $31.03. Now, that's not all savings to the taxpayer. Some of it is just to the individual, but you can see kind of the benefit. Now, you're probably looking at this list saying, Kevin, look, is everything cost beneficial? It's all green. It all looks like there's a cost benefit here, like it's all, saving money. And I would say we haven't gone down far enough, because look, here's where you see things that are not cost beneficial. Some of these programs might be things that you're using and you're going to get mad at me about. So DARE, for example, right here, the cost is $64 per kid, but there's not any benefit. The non-taxpayer benefit is $598. And so the benefit minus cost is $993 loss. So for every dollar you invest, it's a $13.46 loss. And right here on this 45, this is like 45 when they do simulations, how frequently you would get this type of loss. You wouldn't get a positive effect. So 55% of the time. So you're getting a predominance of loss. Why do I go to this website? I go to this website when I want policymakers to understand why we want to invest in programs. So these programs, we were in school programs. Let's just take a look at the Strengthening Families 10 to 14. We talked about that earlier. I'm not doing an advertisement for it. I'm just using it as an example. And here you kind of go over and you see a $3,183 benefit. So for every dollar you invest, a $5.87 per dollar, and you'd get that about 60% of the time. So this is a great way when I'm trying to help my policymakers understand why is it that I want to invest in earlier prevention. And this puts the dollars and cents to it.
Yeah,
What
and
it does,
there are a couple questions about this. Do you mind answering a couple questions at this point?
yeah, if I can answer them, but if not, I'll lead you to who can.
All right.
Yes.
So one person says, so the loss is primarily due to the program being ineffective. Is that
Yes.
okay?
Yes.
And
Mhm.
then,
So,
and
and
then,
these
oh,
are
sorry, go
done
ahead.
these are typically done in trials, and so you see the comparison group is doing better than the control group. So that would be what we call an iatrogenic effect, a negative effect, and things get worse when you do the intervention. And there are a lot of interventions where things get worse. I've done a lot of work in experimental trials. We think everything is going to make things better, and it doesn't. We can and we do sometimes make things worse. Sometimes, if we just don't do anything, it would be better than doing things that are harmful. We want to prevent doing things that are harmful.
And I'll put a little plug for the What Does Not Work recording of the webinar of that. And there's also a self-paced course on what we know has shown to be either ineffective and or harmful. So we do have that knowledge base of
We
many
do, and we
things
should
that
use it.
yeah,
We don't want to redo what we know doesn't work.
yeah, yeah. So one other question, somebody says, so these programs are both evidence-based programs and not evidence-based programs on this list. Yeah, this is not a registry of evidence-based programs on this website.
No.
Yeah.
And if they do have to have some evidence or evaluation in order to get on this website. So there has to have been an evaluation done with effect sizes. So they have to be able to calculate an effect size in order to be on this website to demonstrate impact. So if they're on here, there's been an evaluation of the program that's been able to demonstrate an effect size compared to usually a comparison group. So it's a pretty rigorous evaluation to even be here, but then they go another step and say, what are the cost of doing the program? And do you get the outcomes you think you are?
Great, thank you.
So it's not meant to be an evidence-based list, but if it's on here, you can count on the fact that there's evidence. Does that
Effective
make
or
sense?
not.
Yes. Yes. Did that make sense?
Yeah, thank you. And I
Okay.
want to make sure I don't want to stop you too long because I know you have a few more things to share.
Not much, but is there another question?
Nope, that was it for regarding this.
Okay, well, let's see if we can go back here. Look how seamlessly I did that. So one of the things, that I like to think about is what we really know. And we know that people who feel connected, like the Surgeon General has really been talking a lot about connectedness amongst adults and loneliness being a huge risk factor for mental health. And that teens who feel connected to family and school were 65% less likely to use illicit drugs or prescription drugs as adults. 4% less likely to be diagnosed with STDs, and 51% less likely to report having experienced physical violence in the past year. I think we know this. We know we have to be able to create environments where young people are feeling connected to family and school. And we have a lot of programs that do that. One of the things in the Northwest PTTC does is we have a list of a guide of school-based practices, not programs, but things that any teacher can do, things as simple as positive greetings at the door to increase school connectedness, to increase motivation and engagement in the classroom. And we use practices that have been tested specifically, like the individual practice has been tested, not as much in a randomized trial, but it's not as rigorous as you would get in blueprints, but enough so that you can feel like, yeah, that's a really strong practice. The pattern of evidence is strong enough to say, if I do these things, I can build stronger connection in school. Chris, if you remind me, I'll send that to you. And so maybe we can put it with this as well, just so folks know that that's a resource too. And I think it's important because I kind of see us as hope suppliers. We need to think about how can we be that hope supplier in our communities? How do we supply hope to build connection, to build family strength, to build connection at school? We know we are making a difference. We have the data to demonstrate prevention does work. Programs, policies, and practices are effective at changing behavior. We see that. So 2 questions I would leave you with is, how can you be that hope supplier where you are to give that message of hope, to give that message that we are making a difference and that prevention does work? And then kind of taking that challenge from Nora Volkoff, the NIDA director. What can we do to bring prevention more upstream and make sure we're not getting stuck in that sense that we are thinking of prevention just as overdose prevention? So those are 2 kind of questions I'm leaving you with today. So Chris, that pretty much, I think, gets me to where I was ending.
I would love, as a wrap-up question for you, I would love to know what the title of the webinar was: Prevention Works and a Call to Action. So the prevention works. What would you say if there were 2, 3 maybe top messages that you would want to be sure folks in listening to this webinar, participating in this webinar, take from this in terms of actions they can take as preventionists to be able to share that prevention does work? We know, how can people share this information? What would be the best vehicles, I guess, is the better way of saying it.
Well, I would first look at what local data or state data you have that shows those same norming trends downward. You can bet that those are typically going down in your local community, but look over time. Don't just look at the last 2 years. Don't look since the pandemic and say, look at the trends since the early 2000s. Talk about the fact that sometimes our perceptions aren't what is actually happening. For example, my poor kids, can you imagine growing up with me as their dad and having all this data and them coming home and saying, well, everybody's doing it, Dad. And I'd open my computer and, get to their local school data and say, well, in fact, what you're telling me is everyone's doing it, but I'm only seeing that 20% of kids in 10th grade have ever used marijuana. Tell me, why are you not hanging with the other 80%? Yeah. Because we often look at the 20% and say, oh my gosh, 20% of the kids are using marijuana, when we should be looking at the 80% and saying 80% are not using. So looking at that, more kids are graduating drug-free than at any point since we've started collecting data in 1975. Look at your local data. Keep then in mind that, yeah, we are making that difference. And then the next thing is why? Well, because we're using evidence. We're using an evidence-based approach to making a difference in communities. And we have programs, policies, and practices that we can demonstrate make an impact and that are cost effective.
Absolutely.
I don't know if that's specific enough.
Well, and then so where my mind goes is starting to apply our media advocacy tools that we have in our prevention tool belt in terms of getting this information out to folks. Of, how are we going to get this information to our funders, to our partners? It could be our school partners, our different folks, and could be writing op-ed pieces for our papers, newspapers. What are looking at how do we get this information to the folks that it's important for them to know? Definitely when we're talking about social norming kinds of campaigns, those are really important. But also, I think there's the other piece of those who are in power positions, regardless of their setting, of how can we share this information.
And I spend a lot of time sharing data with you today, and I work with folks who are really in a data-driven area, and we also know that data is not what moves people, where the heart is. It's not where, and so really understanding the story in our community, we have a lot of competing stories. We have a lot of really hard hitting, sad stories. So it's not easy to show that nothing happened when we did our parenting program. That's what prevention is, nothing happening, right? So it's a tough thing to compete with in that way. What I would say is that I really enjoy when you're doing a parenting program, getting the story from program participants who say, my kid talked to me differently after I participated in the program, or you know what, I realized that my drinking was, I was drinking more than I wanted to, and so I've cut back on my drinking, or getting the parents' perspective, the kid's perspective of their parent, so that if they're involved in a program, you can help tell the story through the eyes of participants, perhaps. But really thinking about where can we capture a story that can capture the imagination that helps support the data. And I know that I didn't do that today. I know I was just giving you a lot of data, but we know that the story is really important, that we can't just lead with data alone.
Great. Well, thank you, Kevin. I so appreciate your willingness to facilitate this webinar, pull it all together for us. I'm not sure how clearly we shared up front that Kevin works with the Northwest Prevention Technology Transfer Center, so a sister
Yeah, I don't know if I talked
PTTC.
about that.
Yeah, the sister PTTC to the Great Lakes PTTC. And so I was talking with him, and we were talking about this issue of getting this information out to folks so that people can start sharing it with others. And he very generously gave his time and expertise to be able to do this for our region, as well as I know folks from outside of region are on as well. But I just wanted to say a huge thank you, Kevin, to you for sharing your time and expertise with us today.
Thanks so much for the invitation. I think, Rebecca, we might have one last poll to kind of see how
Oh,
things.
I forgot about the last poll. You have one more. Yes, and then I have a few closing slides. So folks,
Stay on, please.
we have a few more things for you, so don't log off yet.
Chris, why don't you go ahead and start your slides, and we'll leave the poll up so people can do it while they listen.
Okay, and so you have to wait till the end so you can find out what the correct answer is on all of these. So hang tight, and Kevin will give you the correct answer in just a moment. So here are my slides. I'm going to share with you real quickly. Wanted to let you know about some upcoming events that we have. One is on March 20th. We have Trending Now on social media of how to really leverage social media for your prevention programs. On the first Thursday of each month through June, we have our deep dive into prevention ethics. This is an interactive training session where people go into small breakout rooms and we really dive into how prevention ethics impacts our work as in prevention. We have a sustainability planning intensive training course, which is 7 weeks long, happening in April and May. That is just about full. So if you're wanting to participate in that, be sure to apply really soon. We have on April 11th, looking at increasing the resiliency in military connected youth. If you're thinking you are in a community where you do not have military connected youth, you might think twice. When Kentucky added this question to their school survey, they found that 40% of the youth across their state were military connected youth, that they have somebody in their close family unit who are in the military. So if you're thinking it doesn't apply to you, you might go ahead and check in on it. I went to this workshop by our presenter at the NPM Research Conference last year, just because I hadn't been exposed to this, and she really opened my eyes to a lot of things I was not aware of. So highly encourage you to sign up for that. We have a really interesting one coming up on April 18th of harnessing AI in your substance misuse prevention work with Brian Klaas from Johns Hopkins. And then April 25th, if you're looking for more information about strategies for preventing substance misuse in older adults, join us then. And one more I wanted to highlight, or a couple more just real quickly. If you work with within rural communities in your role as a preventionist, be sure to join us for our May 16th webinar. And then one last one I wanted to share is we do have a project management skills for substance misuse prevention practitioners coming up on May 30th. That's a 3-hour interactive training where there'll be small breakout rooms. So you need to be ready for that. If you have not already, be sure to like and follow us on LinkedIn and or Facebook. And you'll see that we're almost up to 1,000 people on Facebook. And I love number goals. I'm that kind of person. I would love to reach 1,000 real soon. So if you haven't followed us, or if there are other folks who work in prevention with you, encourage you to go ahead and follow us. That's how we get information out to you each day. We post every day on that. So be sure to join us. And last but not least, just a reminder to please complete the evaluation form. You'll be redirected at the end of this session. This is the way we can improve what we're offering. And I do read every comment you write in there. So please know it doesn't go into a black hole. It's actually used. And with that, let's see, Kevin, what are the correct answers to these poll questions?
Well, the first one about trends in long-term use is yes, we've seen a decline. So it's true. The first one is true. The second one is youth cannabis use has increased along with legalization, and that is actually false. So the majority of folks, 73 out of 102, said that to be correct. It's false. The third one, more young people are graduating from high school drug-free than at any time since 1975 is true. 94% of the people got that correct. And that youth fentanyl use and overdoses are increasing is true. And 79% people got that correct. So we saw a big change from our first round. And so that makes it seem like, yeah, maybe folks got the message.
I think so. Thank you again, Kevin, and thank you to all of you joining us. And a huge thank you to Rebecca, who's been in the background working tirelessly, making this webinar happen, both before, during, and she will afterwards. So thank you, Rebecca, and I hope everybody has a fantastic rest of your day. Take care.
Thank you. Bye, everyone.
Bye-bye.